Is on acid-base balance. This video is on respiratory alkalosis. Now, what is the basic biochemical change in respiratory alkalosis? Now, this is mainly characterized by loss of acids, especially the carbonic acid. This decreases the hydrogen ion concentration, as a result of which pH increases because both are negatively related, and this results in the development of alkalosis. So, respiratory alkalosis is characterized by primary deficiency of carbonic acid. Coming to the ABG analysis part, let's consider the three components: pH, bicarbonate and partial pressure of carbon dioxide. Because it is alkalosis, pH is increased. Here bicarbonate is metabolic component, so it is normal, and partial pressure of carbon dioxide is decreased in respiratory alkalosis. Now this respiratory alkalosis is mainly characterized by hyperventilation, resulting in decreased partial pressure of carbon dioxide and decreased concentration of carbonic acid. So the main cause is hypoxia, which stimulates the peripheral chemoreceptors, both carotid and aortic bodies, resulting in hyperventilation, leading to loss of carbon dioxide and contributing to the development of respiratory alkalosis. So the causes include high altitude, where the oxygen concentration is very low, atmospheric oxygen concentration is low, resulting in increased respiratory rate, leading to development of hyperventilation, carbon dioxide loss and respiratory alkalosis. Next condition is asthma. The early phase is characterized by airway obstruction, leading to development of hypoxia, increased respiratory rate and alkalosis. What we need to note is later phase of asthma or the severe asthma or status asthmaticus. Here the carbon dioxide accumulates, resulting in development of respiratory acidosis. Early phase of asthma, there is respiratory alkalosis, and severe asthma, there is respiratory acidosis. So next condition is fever, which increases the basal metabolic rate and this stimulates the medullary respiratory center, resulting in hyperventilation and respiratory alkalosis. Next is anxiety, panic attacks and chronic stress activates the limbic system. Increased central drive to breathe sets in, and this increases respiratory rate, leading to development of hyperventilation and respiratory alkalosis. The next condition is septicemia, characterized by release of endotoxins and cytokines. This stimulates the middle respiratory center, resulting in hyperventilation and respiratory alkalosis. The next one is the early or the mild congestive cardiac failure, characterized by decreased blood flow to lungs, leading to development of hypoxia, which stimulates the peripheral chemoreceptors, contributing to the development of respiratory alkalosis by hyperventilation. On the contrary, the advanced or severe congestive cardiac failure is characterized by poor tissue perfusion, and the cells shift to anaerobic glycolysis, characterized by accumulation of lactic acid, and metabolic acidosis sets in. So what you need to notice: mild congestive cardiac failure is characterized by respiratory alkalosis, whereas severe congestive cardiac failure is characterized by acidosis. Now let's consider the ABG analysis part. In respiratory alkalosis, pH is increased because it is alkalosis. Metabolic component, that is bicarbonate, is normal, and the partial pressure of carbon dioxide is decreased here. Now how is this respiratory alkalosis compensated? Let's understand the compensation rules. It always involves a counter variable, but in the same direction as that of the primary variable. Consider this Henderson-Hasselbalch equation, which states that pH is equal to pK plus log of bicarbonate by carbonic acid. In respiratory alkalosis, pH is increased, the metabolic component bicarbonate is normal, and the carbonic acid is decreased. Compensation involves the counter variable. Counter variable for carbonic acid is bicarbonate here, and it involves in the same direction as that of the primary variable. So we have to decrease, body has to decrease the bicarbonate level. Now how is this done? Now all the three mechanisms of regulation of pH come into force. First one is a buffer, which will try to resist the change in pH but will not go for completion. Lungs cannot regulate the pH because they themselves are involved in the disease process. So the main compensation is by kidney, where the bicarbonate that is freely filtered by the glomerulus is not reabsorbed and allowed to excrete. So by thereby decreasing the concentration of bicarbonate. At the same time, what happens? All the cations are prevented from excretion. So the pH returns back to normal. This is how the respiratory alkalosis is compensated. So coming to the treatment of respiratory alkalosis, the first thing we need to concentrate, we have to treat the underlying cause. The second one that can be done in case of panic attacks, anxiety or stress, breathing into a paper bag. So the rationale behind breathing into this paper bag or mask is rebreathing exhaled air, which will help the body to put back the carbon dioxide back to into the circulation. So this was all about respiratory alkalosis. Thank you for your patient listening. Please do like, share and subscribe. So the next video will be on arterial blood gas analysis. Thank you.